helping make your life easier. Moms Every Day.
Thanks for staying with us for Moms Every Day, everyone. Here with us now is Dr. Adkins. And Dr. Adkins, today we're talking about a very interesting topic, and that's robotic surgery. So more and more these days, you all are using robots to perform surgery. Can you do all of your surgeries with robots yet?
Yes, ma'am. Most of the surgeries we do today, we can do robotically.
Oh, okay.
A lot of the procedures that were done previously laparoscopically, we do robotically now, and it actually enables us to do even more operations, minimally invasive, as opposed to older ways.
Sure. Okay. Now, doctor, let's talk too, because you know, this is kind of an interesting concept for people out there to kind of grasp. So what types of procedures do you do and the other surgeons do at Marshall Surgery with a robot?
So we cover a wide spectrum of surgeries. We do gallbladder surgery, we do weight loss surgery, we do gastric reflux surgery, colon resections, cancer surgeries. Basically any surgery that we've done previously, laparoscopic or minimally invasive, we will do robotically now.
Okay.
So.
Well, let's talk to you. What are the benefits of using a robot for surgery as opposed to maybe kind of the older ways that you would go about performing a surgery? So
anything minimally invasive, laparoscopic or robotic, means smaller incisions. There'll be more incisions, but they're all, you know, probably an inch or so or less in size,
okay,
as opposed to traditional surgery with a large incision, 8 to 12 inches in length sometimes. These surgeries then allow the patients to have quicker recoveries. The robotic technology allows us to be more, improve our dexterity and reach into smaller areas and see and do better in these smaller operations with smaller incisions as opposed to a large incision. And the ability to do the surgery with the smaller cuts allows quicker recovery, reduces the risk of hernias and infections after the fact.
All right, Dr. Adkins, I see here there's something called the Da Vinci surgery system. You've been trained on that. So first things first, let's talk about what this is for our viewers. What is that? So
the Da Vinci system, it's the first robotic surgical system available in the United States. It's FDA approved. And that platform, it's not a robot that does the surgery itself. There is a surgeon guiding the robot, but you could almost compare it to power steering on your car as opposed to manual steering in older vehicles. So it allows us to be a little bit more precise, better visualization, less fatigue on the surgeon, allows us to do the cases more quickly and efficiently. And that's one of the advantages of the Da Vinci platform.
Okay, and you know, you offer this to your patients, I'm assuming, correct?
Yes.
Okay, so now let's talk to what made you decide to train on this? Why did you decide to train on the Da Vinci system?
So if people talked to me 3 years ago, they probably would have found me to be not a big fan. And the system actually changed. They improved the docking system and the ability to get the cases started. It made it more efficient and made it more reasonable to do more cases with the robotic system. And so I can tell the patient that I think that we could do your operation, which normally would have been very difficult to do with a traditional laparoscopic approach. With a robotic operation, it would be easier and more likely to complete it with less incisions, which would then hopefully lead to a quicker recovery, but the same good outcome for the surgical procedure itself.
And Dr. Adkins, you've talked to, but you know, how do you believe that your patients are benefiting from a robotic surgery? Because you've mentioned they're minimally invasive, and that's a really important step. So, you know, what are all the benefits that you see with this surgery? So
they're able to recover and get back to their normal life a lot quicker than, you know, a larger surgery. The pain tends to be less. They require less pain medications after the surgery, and they're able to resume their normal activities sooner. And then the long-term effects, where you have a smaller incision, it's less likely for them to develop a hernia later on or other long-term complications from a bigger incision.
Okay, and Dr. Adkins, what have your patients had to say? Because they're the ones that are getting these procedures. So what kind of feedback have you heard from them as far as the robotic surgeries?
Everyone's intrigued by the fact that we're using a robot to do their surgery. They want to know, are you still doing my surgery? Well, yes, of course, I'm operating the robot. But they're excited by the new technology and the ability for me to be able to do the surgery minimally invasive, whereas in the past it might have required that bigger incision, and so thus they can do recovery quicker, and they're able to get back to their normal activities faster, it seems.
And that's got to be a plus for them, because a lot of times when they have these surgeries, they can be down for a while, so having it quick and having it be easy, it's a lot simpler for them. So
yes, ma'am.
Well, Dr. Adkins, that was very interesting. We appreciate you joining us today.
Thank you
so
for having
much.
me.
If you all at home need more information, you'd like to learn more, maybe you'd like to learn more about robotic surgery, you can head over to WSAZ Mobile or WSAZ.com. We'll have all of that information listed for you there. We'll also have the interview with Dr. Adkins, so you can find out more there too. Thanks so much for joining us for Moms Every Day, everyone. Have a great day.